This Good to Go segment is sponsored by Spectrum Health Medical Group.
September is National Childhood Cancer Awareness Month, but the team at Helen DeVos Children's Hospital continues their good work fighting that battle all year long. The Pediatric Hematology and Oncology program at Helen DeVos is one of the only local programs recognized nationally by U.S. News and World Report, and it specializes in personalized care for your little ones. With us today to talk about Childhood Cancer Awareness Month is Dr. James Bonner. He is Division Chief for Pediatric Hematology and Oncology at Helen DeVos Children's Hospital. And Dr. Bonner, it is so good to see you.
It's always a treat to see you, Catherine. How are you today?
I am doing well. Tell us a
Great.
little bit about the Childhood Cancer Program at Helen DeVos.
Well, we're just thrilled and honored, really, to be doing the great work that this team does each and every day. As you know, it wasn't that many years ago that children with a catastrophic diagnosis of childhood cancer were routinely uprooted and sent across the state or even out of state to get to the services of a full-service children's hospital. Now we are so blessed and fortunate here in West Michigan to have our wonderful, beautiful big blue building at Helen DeVos Children's Hospital. And really one of the cornerstones of that over the years has been our children's cancer team.
And then to have that stamp of approval from U.S. News and World Report, I mean, that's no small thing. But how does it make you feel? Because you're really the man behind the scenes who's really
Oh,
got us
thank you.
where we are, so to speak.
Thank you. We are really humbled and gratified. It is, you're exactly right. It's like the National Good Housekeeping Seal of Approval, which of course we're grateful for. But what it really means is an indication that we are committed as a team. We're really dedicated to the care of those precious children and families who are entrusted to our care. And we always want to be the best for them and do the best for them each and every day. The fact that we have some external recognition of that and some signs that we're doing the right things, we're thrilled. And it also, I think, just underscores, as you mentioned, the teamwork that's required, an incredible group of professionals that have come together who care deeply about this work.
You mentioned that we used to have to ship children and their families elsewhere to get the kind of treatment they needed. But how has the treatment of childhood cancer kind of evolved over the years?
It's a great question, and we are really gratified to live in an era where a disease that not many, many years ago was in many cases an almost certain death sentence for our children, which was just tragic. And over the course of my practice lifetime, certainly, and the lifetime practices of my younger colleagues, we've seen incredible improvements in the successful treatment of almost every form of childhood cancer and very, very high cure rates. So the diseases that we really could not hope for a successful outcome are now seeing higher and higher cure rates. But of course, that sets the bar really high for us. It inspires us to say that now those remaining children whose diagnoses are not as easily treated, we don't have the best therapies yet. We're still working on. It makes that fight and that process even more urgent than it's ever been before.
Yeah, okay, so a lot of the answers to those most difficult cases really lie in the research. What's happening on that front, Dr. Fonner?
That's exactly true. That is really going to be the answer. And it's a very exciting time. We are really committed to the research aspect of things. We want to make sure that our care is always world class, the best that a child can receive, really anywhere in the nation, anywhere in the world. And frankly, for rare diseases like childhood cancer that we're still working hard to unravel some of those answers, that means that very often they participate in an open national clinical trial of the best, newest, most promising new therapies that are available. And there are some really exciting breakthroughs, harnessing a child's own immune system to help us fight that cancer in new and exciting ways that I hope someday in the not too distant future will make things like chemo and radiation look obsolete.
Well, thank you so much, Dr. Fonner. And folks at home, if you'd like to help Helen DeVos Children's Hospital provide those services that he mentioned and so much more, visit give.helendevoschildrens.org. Give.helendevoschildrens.org.